Hi, today we are going to discuss about cashless process in health insurance. Now this cashless process is applicable whether you are a retail health insurance policy holder or you're a group policy holder, especially in organizations. What is a cashless process? Cashless process is a facility offered by the insurance company to all its policy holders to get treatment at a hospital without having to pay the bill. The insurance company will directly settle the bill with the hospital. You can avail this cashless facility at any network hospital which is impaneled by your insurance company or your third-party administrator. For more information around cashless hospitals in your insurance company's network, do visit PlanCover.com. What happens in case the hospital you want to go to is not on the cashless network list of your insurance company or your TPA? Well, in that case, you will have to file your claim as a reimbursement claim, which means that you have to first spend money at the hospital, settle the bill at the hospital, come back with all the documents, fill up a claim form, and then apply to the insurance company to get your money reimbursed back to you. To avail the cashless facility, here are the following steps you need to follow. First and foremost, you should be carrying your cashless Mediclaim cards. In case you don't have your Mediclaim cards, please log into your account on PlanCover.com portal, the employee benefits portal, and you can get an e-card from there. Along with that, you need to carry any Government of India photo identity proof, which has your full name as well as your date of birth, exactly in the same way as is mentioned in your health insurance records. What happens in case you're not carrying your cashless Mediclaim card? Well, don't worry. It is still possible that you can get your claim validated as a cashless claim. Please ask our team more on how you can do that or watch our video on our YouTube channel. Once you reach the hospital, please ask for the insurance help desk at the hospital. The insurance help desk will take your details of your Mediclaim card, details of your photo identity proof, and will fill up a claim form, which is a pre-authorization form, in which they will note down your details, the policyholder's name, the patient's name, the necessary details around your policy document, and they will also get the treating doctor to fill up an estimate of the hospitalization. Your hospital will already know what needs to be filled up. Some hospitals ask you to get this form filled up from the treating doctor, while most other hospitals get this process done on their own. Once this pre-authorization form is filled, the pre-authorization form is sent to your insurance company or your TPA requesting for an approval. This is sent via email or in some cases via fax. Once the insurance company or the TPA receives it, they start putting it into process. Typically, the turnaround time from the receipt of this pre-authorization request to the actual approval should not take more than 2 to 4 hours. In some cases, your insurance company or your TPA may put up a query. These queries are often put up when the insurance company or the TPA has lack of clarity on what really the treatment is going to be or would like some more information before they finally approve the amount. Once the TPA or the insurance company approves the amount, they generally do not approve the entire amount that has been requested by the hospital. Also, very important for you to note is this pre-approved amount, whatever the amount be, can definitely be reversed at the time of final discharge. There are certain circumstances where the inputs sent by the hospital for the treatment are limited. But by the time the treatment is done and the final discharge summary is made, some new evidences can come to light which may be suggestive of certain ailments which are excluded from the scope of your policy. Please watch our video on the exclusions in health insurance. In case your pre-approval is getting delayed, please reach across to the team at PlanCover, and PlanCover claims team will assist you in expediting your approval. So once the approval, as I said, is received by the insurance company or the TPA, there are three possibilities that will happen. One, as I said, there may be a query. Second, the insurance company may reject to honor the claim. Third, they may approve a partial amount. In case they reject to honor the claim, they will give you a reason why they are rejecting. Sometimes it's possible that even after rejection, you pay up at the hospital and you can file for reimbursement, and the case may get settled in the process of reimbursement. So now assume you've gotten a certain amount approved as a pre-approval, the patient has been treated, and now the patient is ready to get discharged. What happens now? Well, the process that was done at the time of admission will now get repeated at the time of discharge. At this point in time, the hospital will generate the final bill. The treating doctor would create a discharge summary. The hospital will send this discharge summary, the final bill with the breakup, and a bunch of investigation reports that have been carried out directly to your TPA or your insurance company. Upon receipt of these documents, the same evaluation process is repeated all over again. At this stage, again, all the three things that could have happened or may have happened at the time of pre-approval can get repeated, which means either the claim gets approved, or there is a query, or the claim gets rejected. In case there is a query, your hospital or the treating doctor will have to respond to that query. In case the claim gets rejected, the insurance company or the TPA will give you the reason for rejection. You can represent again, and sometimes representation also helps getting the claim approved even after rejection. And as I said, the best option, the best case scenario is your claim gets approved. This approval will be as per policy terms. In case, let's say the claim is for 1 lakh and the approval is for 90,000, at this point in time, 10,000 would be paid up by you, and 90,000 would directly be paid by the insurance company to the hospital. This amount, as I said, is a function of the terms under your policy. Once this final approval is in place and you settle the balance with the hospital, you are good to get discharged. At this point in time, do not forget to take copies, which are typically photocopies or duplicates of your bill, your discharge summary, and all your investigation reports.